Today is the day. Nandito kami sa Ysera. Vlogger. Jason. Pwede mo si Ars na. So, patient. Contract signing. Okay. Ikaw.
Kaya pong yan, no? Labas yung kamay.
I was sedated all throughout the rhinoplasty procedure. At this point, although I was already awake, I did not have any recollection of this time when they showed me my new nose in the mirror. I was awake during chin augmentation. I was given local anesthetic on the chin, and so I was pain-free throughout. After both procedures, I still had a little bit of grogginess from the sedative during rhinoplasty. An elastic adhesive tape was applied over my chin to keep the silicone implant in place for a few days.
Mas doon lang tayo pag wala.
Hi, this is my second day post-op rhinoplasty, so Gore-Tex rhinoplasty and silicone chin augmentation. So I had my procedures done by Dr. Patrick Tan in Ysera Aesthetics Clinic in Quezon City. I'm currently here in Plaza 1, which is a condominium unit in Quezon City near Santa Mesa. So the procedure went really well. I'm so thankful to Dr. Patrick Tan, the anesthesiologist, and all the staff at Ysera for looking after me during the procedure. It was uneventful. I was sedated during the rhinoplasty. I was very comfortable and stable, and during the chin augmentation I was awake and I had local anesthetic for the procedure. The rhinoplasty was about 3 hours and the chin augmentation lasted for about an hour or so or less. So yesterday, which was my first post-operative day, it was, I would say, very bad. My chin was really sore. I can remember during the procedure when I was awake that there was a lot of manipulation and I could feel that there was some manipulation in the bone. I think that's what's causing most of the pain. But surprisingly, the nose, I don't feel a lot of pain. I don't even think there's pain, but there's just discomfort. Right now I'm very stuffy. It started yesterday after the removal of the nasal flap. Right after the surgery, the most uncomfortable, I would say, aside from the pain of the chin, was the nasal flap because I couldn't breathe through the nose. I was mouth breathing, and so it was so hard to breathe and it was hard to sleep because of the discomfort. There is also that fear of not being able to breathe if I slept. So the whole night after the procedure, I wasn't able to sleep. I was just lying down in bed. I was just closing my eyes, just trying to get some rest. And yesterday, or last night, after the nasal flap was removed, I was able to have a really good rest. I was prescribed celecoxib for pain, but the approval of Dr. Tan, I added paracetamol, so I took paracetamol 1 gram every 6 hours, and it helped to relieve the pain from the chin. So yesterday as well, my nose was really swollen right here, and the swelling reached up to my upper eyelid, at least the middle half of my upper eyelid. So I was really looking horrible yesterday. Now it's a bit better. The pain on the chin is a bit better as well. I would say I'm painless when I'm not talking or eating. There's pain when I eat or talk. So that would be my update. What I did, I followed the instructions very carefully about diet. So I'm now having soft diet with cool foods. I bought some vitamin C to aid in my healing process, and I also made sure I drink juice with vitamin C. I bought pineapple juice. I also followed the instructions regarding cold compress, so I'm doing cold compress 3 times a day for 15 to 20 minutes on my forehead, my cheeks, and above the chin or down here. So it helps relieve swelling and puffiness. So at the moment, my day 2, I would say the most uncomfortable thing now is the nasal stuffiness. So because I'm very adjusted, sometimes I couldn't breathe through the nose and I'm forced to breathe through the mouth, which is terrible when I sleep. So like last night, after 3:30 in the morning when I woke up, I was very congested, and so I was breathing in the mouth. It made sleeping very difficult. Other than that, I'm okay. I feel like I'm healing. I'm also cleaning the suture sides very carefully as instructed 3 times a day with normal saline, betadine, and upiracin, using sterile swabs, cotton swabs. So that's it for today. So these are the stuff that I use for cleaning the sutures or the surgical site in the nose. So I have sterile cotton applicators. And then at first I use sterile normal saline. And every time I apply any of the solutions, I use one cotton tip applicator every time to avoid contamination. Second would be betadine or povidone iodine, but this is only used for the first 3 days. And lastly, upiracin, which should be used for 10 days. These are the medications that Ysera prescribed for me. So first, antibiotic comoxiclav, which I have to take 3 times a day for 1 week. And then this is celecoxib for pain, which I should take 2 times a day for 5 days. And then tranexamic acid, which is somewhere here. Tranexamic acid to prevent bleeding, which I take 3 times a day, and this is only for 3 days. Then on top of the things that they prescribed, I decided to take multivitamins with zinc for faster healing and paracetamol on top of celecoxib for better pain relief. I bought some cold pack for cold compress, which I do at least 3 times a day or 3 to 5 times a day for the first 48 hours. First few days, I decided to eat cerelac and some oatmeal only, and of course clear liquids because it was a bit hard to do and eat because of the pain, especially at the chin. And I made sure that I chose something that is complete with nutrients and vitamins and minerals, like cerelac for baby, but it's up to you. The advice is to eat cool, soft foods during the first few days after the operation. And then I had to use straw to drink water or liquids during the first few days because it was also a bit hard to drink water from a cup, in my experience. Hi, so today's my 3rd day post rhinoplasty. So I went for follow-up checkup for day 3 post-operatively after cortex rhinoplasty and silicone chin augmentation at Ysera with Dr. Patrick David Tan. So what they did was they of course checked on me. They first removed the dressing of the ear where the cartilage was harvested. So if I don't know if you noticed, but my right ear is red compared to the left, and I can feel that it's numb. So I'm guessing there's still some residual anesthetic even after 3 days, which is a bit scary, but I hope this is usual. There are 2 suture sites, one on the front and a longer one on the back. And they told me to clean the suture sites the same way as cleaning the suture site on the nose. So first using normal saline, and then betadine, and then mupirocin until suture removal. And betadine would be used for only 3 days. Today's my 3rd day, so this will be the last day of me using betadine for my nasal sutures. I thought that the bandage tape on my chin would be removed today, but Dr. Tan extended it for another 2 days. I haven't asked why, but I'm guessing because I mentioned that I still feel some pain on my chin, and he assured me that it is expected and that it is normally more painful than the nose. Regarding my nose, I still don't feel any pain, to be honest, but I feel stuffy, although it is way better than yesterday. I feel that I can sleep better tonight. They also cleaned my nose today and instructed me again how to do it. I told them that I will not be able to come back for the 1 week follow-up for cast removal because I'll be going back to the Magenta City tomorrow. And so they said that it's okay. In fact, I can do the cast removal myself. I don't know if it's because I'm also a doctor, but I feel that I can do it. This is just to manually remove the cast. But they instructed me to put steroid strips on the bridge to help the cortex stick to the bone, if I'm not wrong, or the cartilage down there. 2 weeks post rhinoplasty, or 12 to 14 days specifically after rhinoplasty, the sutures can be removed, and they've allowed me, or they have agreed that I have an ENT do it. They printed out a medical certificate for me, which I can show the ENT. So overall, I'm feeling better now. The pain on my chin is significantly lesser compared to the first and second days post-op, but I'm still taking regular paracetamol on top of celecoxib just to keep myself as comfortable as possible. The nasal stuffiness is way better. Thank God I don't have any other complications like bleeding and things like that. I also started cleaning myself today. I used dry shampoo for my hair. I bathed myself just below the face and just used wet wipes for my face. I also bought some collagen to help in wound healing. That's my own. Dr. Tan didn't allow me to do that. I also bought some probiotics. I'm not very good with antibiotics. I tend to have diarrhea or antibiotic associated diarrhea, so I just bought some probiotics to supplement my normal gut flora, and that's it. So far so good. So it's day 4 post rhinoplasty and chin augmentation. I am still in Quezon City, but I'm about to fly this afternoon back to the West. So far, I am feeling better. Swelling in the face is very minimal, I would say. The nose is, I can feel that it's now shrinking a little bit. I'm no longer using betadine for the nose as instructed. I'm just cleaning it with normal saline and mupirocin using sterile cotton swabs. The congestion has also improved a lot, the stuffiness. So last night when I went to bed, I was still stuffy, but then it slowly went away, and now it's just very minimal stuffiness. My chin is also better, swelling is also receding, and the pain is also subsiding. I'm taking all my medications. I have a lot. As you can see, I still take antibiotic, amoxiclav, celecoxib. I added probiotics, paracetamol, and multivitamins and minerals. So my ear, it looks like it's more swollen today for some reason, and it's still numb. I haven't asked my doctor whether this is expected or is it something else, is it a nerve injury of some sort, and I'm just hoping that it is just residual local anesthetic from the harvest of the cartilage. That's really it. I'm feeling better. I'm still eating soft food
roots, specifically Ysera lang, because it's still a bit sore when I chew. So I'm trying to preserve my chin to help it heal as quickly as possible. Hi, it's day 7 post rhinoplasty and chin augmentation. So I have just removed the cast on my nose earlier. So far my nose feels okay, it's still a little bit stuffy. I don't feel any pain, but I felt that my nose tip was numb when I tried to wipe it with wipes, and I know it is still a bit swollen. Suture site is healing well. There's no redness or any unusual discharge. My chin is still a little bit sore, but I'm able to manage the pain with paracetamol 1 gram every 6 hours. I'm no longer taking celecoxib. I haven't been doing cold or warm compress anymore. I got lazy. But I know it's only as needed if there's still swelling. My face, probably there's still a little bit swelling here because I'm not normally this chubby on the cheek. Down here, probably a little swelling down here, but not opposite. I'm still taking antibiotics. I'm still continuing to take multivitamins and minerals, collagen, and I'm keeping myself hydrated. So I'm now feeling overall better compared to the first few days. So I'm just gonna update Dr. Tan and the rest of the team about my progress. After this, I'm going to tape my nose near the bridge as I've been instructed using steri strips. Hi, so this is day 14 after rhinoplasty. So as you can see, the sutures have been removed. They were removed 2 days ago by an ENT. An ENT was a schoolmate of mine in medical school, and I was pretty confident before I went to him that he will be able to remove my sutures because I know that they have all these tiny instruments, and I was totally correct. He was able to remove my sutures successfully on the nose and on my right ear. So a part of my suture site wasn't fully opposed to each other, but that's okay. I can see that it's healing now. The procedure was a bit painful because there were already scabs forming on the suture, the incision site, and so he had to remove the scabs so he can remove some of the sutures. But after the procedure, it was okay. There was just some blood, which was a bit painful, but very tolerable. I started working in the hospital today, so I had to wear a mask. So you can notice there's some abrasion on my nose. So I think because the skin on the tip of my nose has become thin because of the stretch from the rhinoplasty. I'm just worried that it might progress, so I'm going to put some bandage tomorrow below the mask to prevent it from getting worse. Otherwise, I'm no longer taking any pain reliever. I'm not taking any anti-inflammatory as well. I have stopped taking antibiotics. I'm just taking multivitamin and mineral supplements and collagen. And I'm continuing to put tape on my nose as advised up to 1 month post-op. And I was also advised to do warm compress, but I'm not very keen on that. I'm too lazy for that. I don't think I'm that swollen anyway. I'm continuing to clean my wound with normal saline and mupirocin just because it's fresh from suture removal, so just to prevent infection. The hematoma looks like it's already healing in my ear, starting to come off, so I'll just leave it to come off on its own. Yeah, so otherwise I'm comfortable. My nose is not that stuffy anymore. It's a little bit stuffy, but I'm able to breathe well even in the night. So that's it. Hi. So this is week 5, or exactly 37 days after my rhinoplasty and chin augmentation. So as you can see, I no longer have the tape on the bridge of my nose. I stopped using it on the 4th week as advised. My incision area is already closed, and you
it's already starting to heal. I also started to put a scar ointment starting on the 4th week post-op. The tip of my nose is still a little bit swollen. It's a bit red at the moment. Stuffiness is already gone, but I had an upper respiratory tract infection this week and I'm still healing from it, so that's why my voice is a bit harsh and my nose is a bit stuffy. But I don't think that the stuffiness is related to the surgery anymore. So overall, I'm healing well. I still feel I have a little bit of swelling around the eyes. I think it's probably related to the surgery. My chin is no longer painful. Stitches are still in there. I know it'll take a while for the absorbable stitches to be dissolved. So yeah, everything looks good. I can appreciate the shape of the nose a little bit now. On the side, on the front, I hope it will continue to form. And yeah, so that's been my rhinoplasty and chin augmentation journey. Thank you to Dr. Patrick, David Tan, and Ysera for all their help and all the staff in there. Bye.